Today, we will learn about Alzheimer's disease, a neurological condition that progressively impairs memory, cognitive abilities, and basic tasks. It primarily affects those aged 65 and older, with over 6 million Americans impacted. Currently, Alzheimer's is the seventh leading cause of death in the United States and the main cause of dementia in older adults. Dementia involves the decline of cognitive functions like thinking, remembering, and reasoning, along with behavioral issues that greatly impact daily life. Its severity ranges from mild, with minimal functional impairment, to severe, requiring complete dependence on others. Various brain changes can cause dementia, including Lewy body dementia, frontotemporal disorders, and vascular dementia. Mixed dementia, such as a combination of Alzheimer's and vascular dementia, is also common. Alzheimer's disease, named after Dr. Alois Alzheimer, was first identified in 1906 through brain tissue observations in a woman with an unusual mental disorder. Symptoms included memory loss, language difficulties, and erratic behavior. Post-mortem examination revealed amyloid plaques and neurofibrillary tangles, key features of Alzheimer's. These abnormalities and the loss of neuronal connections disrupt brain communication, impairing cognitive function and coordination. Alzheimer's disease causes complex brain changes that start a decade or more before symptoms appear. Early stages involve the buildup of amyloid plaques and tau tangles, leading to the loss of neuron function, connections, and eventually neuron death. Initially, the hippocampus and entorhinal cortex, vital for memory, are affected. As the disease progresses, more brain areas are damaged, causing overall brain shrinkage. By the late stages, significant brain tissue loss is evident. Memory issues often signal the early stages of cognitive decline in Alzheimer's disease. Some individuals with memory problems may have mild cognitive impairment, MCI, where memory difficulties exceed normal expectations for their age, but do not significantly affect daily life. MCI can also involve movement challenges and olfactory impairments. Older adults with MCI have a higher risk of developing Alzheimer's, though some may not progress and might even return to normal cognition. Early Alzheimer's symptoms can vary, including non-memory issues like word retrieval, spatial awareness, and impaired reasoning. Researchers are studying biomarkers in brain scans, cerebrospinal fluid, and blood to detect early brain changes in those with MCI and those at higher risk of Alzheimer's. However, more research is needed before these methods can be routinely used for diagnosis. As Alzheimer's progresses, individuals experience increased memory impairment and cognitive challenges, such as wandering, disorientation, financial management difficulties, repetitive questioning, prolonged task completion, and personality changes. This is known as mild Alzheimer's disease and is often when diagnosis occurs. In the moderate Alzheimer's disease stage, damage extends to areas controlling language, reasoning, conscious thought, and sensory functions, making it hard to perceive sounds and odors accurately. Memory and confusion worsen, making it difficult to recognize familiar people or learn new information. Complex tasks become challenging, and hallucinations, delusions, paranoia, and impulsive behaviors may occur. In severe Alzheimer's disease, widespread plaques and tangles cause significant brain shrinkage. Individuals lose the ability to communicate and depend entirely on others for care. As the disease progresses, they often become bedridden, with a gradual decline in bodily functions leading to the end of life. Recently, scientists have made significant progress in understanding Alzheimer's disease, though the root causes are still not fully known. Likely contributors include age-related brain changes, genetic predispositions, environmental influences, and lifestyle choices. The impact of each factor on the risk of developing Alzheimer's may differ for each individual. Scientists are actively researching Alzheimer's disease, focusing on plaques, tangles, and other biological characteristics associated with the condition. Advanced brain imaging technologies aid in observing the progression of abnormal proteins within the living brain and changes in brain structure and function. They are also investigating early disease stages by analyzing changes in brain and bodily fluids detectable years before symptoms appear, aiming to improve understanding and diagnostic methods. A key mystery surrounding Alzheimer's is its prevalence in older individuals. Research into typical brain aging seeks to uncover how age-related alterations compromise neurons and various brain cell types, contributing to Alzheimer's pathology. These changes include brain atrophy, inflammation, vascular issues, free radical generation, and mitochondrial dysfunction, all affecting cellular energy production. Alzheimer's disease is typically influenced by a combination of genetic, lifestyle, and environmental factors rather than a single genetic cause. Over 80 genetic regions have been linked to Alzheimer's, with only 3 genes confirmed to trigger the condition when modified: APP, PSEN1, and PSN2. Individuals with Down syndrome who have an extra chromosome 21 carrying the APP gene face an increased risk of developing Alzheimer's. The APOE gene, with variations like APOE4, also influences Alzheimer's risk, while APOE2 may offer some protection. However, the certainty of developing Alzheimer's remains uncertain due to the complexity of factors involved. Research suggests that factors beyond genetics, including vascular ailments like heart disease and stroke, as well as metabolic disorders like diabetes and obesity, may contribute to Alzheimer's disease. Efforts are underway to determine if addressing risk factors for these conditions could lower the risk of Alzheimer's. Lifestyle factors such as balanced diet, exercise, social engagement, and intellectual stimulation have been linked to promoting overall health and potentially reducing the risk of cognitive decline and Alzheimer's. Clinical trials are ongoing to investigate these connections further. Physicians use various methods to diagnose Alzheimer's disease, including interviews, cognitive assessments, medical tests, mental health screenings, and brain imaging scans. These procedures may be repeated over time to monitor changes in memory and cognition. Patients with memory concerns should consult their physician to determine if their symptoms are due to Alzheimer's or other conditions. An early diagnosis allows for prompt treatment initiation and helps families plan for the future, establish support networks, and participate in clinical trials testing new treatments. Researchers are actively exploring multiple potential treatment options for Alzheimer's disease, though a definitive cure remains elusive. Some medications show promise in temporarily enhancing memory and cognitive function and managing symptoms and behavioral issues. Additionally, non-pharmacological approaches are being investigated for symptom management, such as stress reduction techniques. Addressing these symptoms can enhance comfort for individuals with Alzheimer's and support caregivers. Healthcare providers emphasize the importance of discussing treatment options to determine the most suitable approach for individual circumstances. If you liked the video, please subscribe the channel to stay tuned.